guys, I want to welcome you to the weekly Wednesday for the Financial Freedom newsletter, where every week, every Wednesday, we delve into something inspirational, motivational, something excerpt taken from the Financial Freedom weekly newsletter. Wherever you are, if you're listening on Spotify, on iTunes, Google, be sure to click the like, subscribe, share, comment. And without ado, let's get into the show. Hey guys, welcome to this week's podcast episode for the Financial Freedom for Physicians podcast. I'm your host, Dr. Christopher Liu, and I'm really excited for today because I'm always interested in getting people thinking outside the box, outside of traditional modes, changing the world. And today's going to be a fascinating discussion on Web3, decentralization, owning your content. It's going to be fascinating. I'm happy to welcome Dr. Melissa Walsh, and she's a board certified physician, OBGYN. She's a Web3 healthcare advocate, public speaker, and she's got a wealth of knowledge in this field. So Melissa, welcome.
Thank you. Thank you so much for having me. It's great to be here and spread the word of Web3 outside of just crypto.
We were talking backstage, and it's almost like if you listen to the news, it's like you're automatically inclined to think that this field or industry has no future whatsoever. But tell the audience about your background, your training, your story, and how you got into this space.
Yeah, so I'm, as you said, board certified OBGYN. I've been in practice, encompassing residency for about 13 years. I was very much on a traditional public service pathway. My husband actually got into Web3 NFTs. He's a musician and the first ever CryptoPunk rapper, Spotty Wi-Fi. So through his journey and supporting him, I started learning more about Web3 and the different applications of the technology. And that's how I got into learning how fascinating and just revolutionary this technology can be for the healthcare field.
Yeah, I know, a lot of physicians, they're still struggling. They're still on social media and they're just getting into it right now. Really missed the train. And then one of the most common questions I get is, what is Web3? Is it what they help people grasp this concept?
Yeah, so my first ever understandings of what Web3 could be were referencing that movie Ready Player One, where somebody's in a VR headset and they're interacting in the world through, the connectivity of the internet, but through a virtual space. So what I think of with Web3 is just another layer of technology on top of our current internet. So the way that our internet now lets us have this Zoom, lets us have emails, transactions, all of that. With Web3, it's another layer of technology that kind of encodes trust between those interactions versus what we have now, which is just us putting data out there and not really knowing where it's going.
Yeah, I love that. And this idea of concept of the first iterations was read, and Web 2 was like read, write, and now you can own it. And a lot of people, they want to engage, they want to communicate with the audience. Most of them are physicians, and they're thinking, okay, so how is Web 3 different than Facebook, Instagram, Twitter? Is this another platform? What is your response?
Yeah, I think that's, a big barrier to onboarding in this space is like an understanding and education about what technology really means. And as physicians, we hate learning another EMR, another platform, another series of clicks. And this isn't that. This is enabling the current technology that we have, but allowing us to have more ownership over our actions, over our identity within the space. And I think that, that's really the way forward for affecting a lot of industries, especially medicine.
Yeah, because studying this space, talking to a lot of industry leaders such as yourself, and one of the biggest barriers is education and understanding the technology. I kind of want to talk a little bit about this idea of we're in a past, you were this idea of how you're going to be interacting in Web3 with decentralized wallets. Just kind of, overarching theme is, this idea of like in comparison to logging into Instagram or Facebook, how is like Web3, how are you going to be interacting?
So, give you an example of like one of my first intros to Web3 outside of NFTs or, non-fungible tokens. And for those who don't know about NFTs, it basically is code that lets you own your creation. So like my husband produces music. This is how he is able to own that music digitally and tie it to, physical means as well. So if you take that concept of owning something digitally, you should be able to own your identity and own your credentials, own your license. That is what enables us to lawfully practice in this country, in this world. So the first organization that I came to know in Web3 was the HPEC group. It stands for Humanitarian Physician Empowerment Community. It's a platform started by Dr. Leah Houston. She created this platform so that all of your diplomas, credentials, licenses could be put onto a digital wallet so that every time you need to get a new license or license renewal in a different state, etc., it's just all in one place. So you don't have to go through this, 3-month, 6-month long process confirming again that you graduated from medical school the same time you've always graduated. So, that is like one big direct use case of this technology that I felt like was like an aha moment. This clicks. This is something that we should have. It would save everybody time. It would save everybody money because, millions are lost with onboarding new healthcare professionals.
Yeah. It's interesting because talking about non-fungible tokens. If mainstream people are listening to this, they're thinking, oh, non-fungible tokens, it's pump and dump, it's scams, it's but there's actually a lot of utility in it. You just touched on some of the utilities with medicine and some of the applications. Go into further, like in terms of the potential of using this technologies. You talked about digital identity, but there's other applications that non-fungible tokens can be used in healthcare.
Yeah, definitely. I mean, there's it's still very early in the development and scaling of the technology, but just the basic concept that this code of Web3, of NFTs allows for that data ownership can also tie to tokenization through NFTs to your healthcare data. And that can be de-identified for population health studies and improvements, but also for just the transfer of healthcare records between systems. That is something that, sounds like a far out fantasy, but they're actually doing it in this country called Estonia, out in the North Baltics, a system, a private blockchain that allows for interoperability between different healthcare access points, whether it be a clinic, a hospital, and for the integration of those healthcare data, which, would be a game changer for us in the States if you didn't have to wait for a fax to get your healthcare records in.
I haven't used the fax machine in over 20 something years. So it's funny that, healthcare organizations are still, relying on this technology, but it's,
yes, fax machines and pagers, we're keeping it alive.
The other thing is, you mentioned this idea of, data, but, for example, in the States, you go to one clinic or hospital and then you go to a new clinic hospital, you have to start all over again. It's like, and there's like this, so much waste and time wasted, it's like so much friction. Tell us more like how, you talked about credentialing and, but, there's other applications as well, which is quite interesting.
Yeah. So, in addition to, digital identity and credentialing, you could also think of digital identity and your healthcare records. So what they do in Estonia is that when a baby is born, that triggers a sequence services and records that are created from, public health registration to their birth certificate, social security equivalent over there. So if you have that digital identity created from the onset of your life, every health event could be tied to that record so that when you go to your next healthcare provider, you don't need to reinvent the wheel, ask your mom for records from, whatever time. It'll all just be tied to you. And the encryption level of the code also is more HIPAA compliant than what we have now. I mean, the fax machine is not very HIPAA compliant. Web3 tech and coding does allow for that. And it doesn't mean that each system will need to install a new EMR or all get on the same kind of software version. This technology allows for data to be taken from different systems and integrate them so that you can have just one complete record. If you go further from that, thinking about everything that's tied to your healthcare record. So when you see a physician and whatever's going on in that visit, we can just concentrate more on the visit and the interaction with the patient, record our note, because that's never going to go away. That's as old as time. But all of the things that are tied to that record of that visit, such as their medical billing, their pharmaceutical, history, as well as new prescriptions, all of those things can be tied into that. And because the nature of blockchain, of Web3 tech, is to create an immutable, uneditable audit trail that's time-stamped, that further lends it to healthcare uses, because now we have everything tied from the healthcare data to the billing and coding, revenue management, and the supply chain with the pharmaceutical records. So it's a lot of different things that all come down to that data that's produced by the healthcare record that comes from us who provide the care.
Like I said, this way you're describing, the future of healthcare, the use of data, the use of blockchain. One thing I wanted to touch upon is how you're seeing AI being incorporated into blockchain and these new technologies.
Yeah, so that's another exciting aspect of it, because AI, machine learning, AI has been around. AI has been integrated into our society even without us knowing. Now we're just getting to interact with it a little more directly. But because the blockchain organization of data is so much more streamlined, it lends to AI analysis so much more robustly than our traditional data sets because of an integration between data from different sources. I'm really excited about that application because it can really improve our population health approaches by seeing, patterns in environmental influence, dietary influences, in, use of certain drugs. Just the possibilities are endless. And I think, it can help at the local level up to, national or even global levels potentially.
And you recently started a new position, medical director, Pomelo Care, which is a virtual practice leveraging cutting edge technology, providing pregnancy related and newborn care, but potentially other specialties. How do you see hospital organizations, leadership reacting to Web3, AI, blockchain? Are they on board? Are they resistant? Do they not understand it? Fear? Tell us more.
Oh, yeah. I mean, there is always fear. Humans innately do not love change, although change is our only constant, right? I feel like my experience in medicine has been, we've kind of been behind, especially in OBGYN. We're not privy to a lot of technological advances as other fields, which makes sense in a way. Pregnant women, we don't want to experiment, things like that. But we can use technology to help improve processes. We can use technology to streamline care because we know there's, a global burnout situation that has been happening and has now come to a boil. And that's really, I see from the system issues. This is a system that's not built by physicians for physicians or for the people that they were caring for. It's a lot of, billing, volume. Did you code the right way? It's like, I didn't go to medical school to code. Went to medical school to help people, to deliver babies, bring literal life into the world. I think that's enough. I'd like to have a system that makes that a little easier so that you guys can get paid and I can continue to do the things that I love to do. At Pomelo Care, I'm very excited to start this position. It's a very innovative platform and very unique in that, we're not just providing care at a virtual access point, but we're also trying to coordinate the care with the in-person providers. So those times between the visits where the patient might not be able to reach somebody in a timely manner, they can get in touch with us within 5 minutes for sometimes a casual question, sometimes more of an urgent triage situation where they have to make those decisions. Do I drive an hour to the nearest hospital, or can I monitor this with a healthcare professional at home? I think that with the burnout situation that we're all confronted with in healthcare is a boon, because if you could have that kind of almost a little bit of a virtual safety net where, a trained, board certified healthcare professional is there to answer your patient's questions, and so that they don't show up in the ER for something that probably didn't need to be seen in the ER, and they didn't need to waste 6 hours there. And then, all of the redundant testing that ends up getting done in emergency situations, that's where we're developing this platform to help curtail and mitigate those risks and make care more comprehensive for the patient, which also in effect will reduce stress on the primary provider. Because in addition to that, we're not just doing that in the background. The records are available. The healthcare records that we create of those interactions are available to the provider so that they can see, oh, my patient called in over the weekend. They can address that. We can help coordinate earlier visits. We also provide nutrition and lactation support and mental health support, which is services that should be seen as normal for prenatal care, but unfortunately aren't considered always standard because of, short resources. I think that, the concept of having a virtual practice supplement the care is a very new concept to the traditional medical field, but I haven't spoken to any of my colleagues who are like, oh no, that's a horrible idea. It's like, no, you don't want to be up 24/7 because you need to provide care at your optimal energy and well-restedness. So having somebody cover in between is, I think, a great solution. The other thing is that our platform works with insurance, provide value-based care. So it's not an extra cost to the practices or the hospitals. Right now, we're mostly an employee benefit through several institutions. So I think it's, a great starting point, and I'm excited to see us grow.
Yeah. Yeah, really awesome. And I know because you're also an advocate, tell the audience, because I know you spoke at NFTLA and Miami as well. Correct me if I'm wrong, but, tell the work that you're doing with trying to promote Web3, healthcare, advocate.
Yeah. So, my role in advocacy is mainly just to educate the general population, as well as my physician colleagues and healthcare providers, about the technology's potentials, that we should expect more from our healthcare system. Because the way I see it now, it's like very business-like, and we're seeing it in our health outcomes as a nation. We see that we're spending, almost 18% of our GDP, and our health outcomes are worse than other countries who are spending less. It's like, if we could leverage technology to reduce redundant spending, to integrate health records so we have a more complete picture when we're treating a patient, and also for patients to be able to access their healthcare records. It's actually the law. The Cures Act passed last year made it the law that they have access to their records immediately, but how that making it a law and making it happen, there's a big bridge that we need to cross. And I think that bridge is with technology. So a big part of my advocacy work is just letting people know this is something that could be a solution. I'm not saying this is like, now it's going to be all flowers and unicorns when this is implemented, but it's going to be a little better than what we have available now.
Really great. And where do you see the future of healthcare with these new technologies? Because there's talk about, hospitals, is going to be basically for the most acute, but then, more of the care is going to move into homes. You're going to have virtual health, better access to remote areas. What do you see?
Yeah, I think that, especially, there are so many things going on in the world right now in the nation, but there's many, many labor floors that have been closing around the country. There are states where there are only a handful of OB providers in certain areas. So I think virtual care is really going to continue to grow. I mean, especially after going through the brunt of the pandemic and, seeing how, you can't just quarantine everybody all the time indefinitely, especially those with chronic diseases, especially pregnancy. Pregnancy is a very time-limited situation. It doesn't pause because there is a national emergency, and virtual platforms, virtual care, is a solution to help step up, at least for, the low risk or, non-emergency situations, and also to help prevent emergency situations, to help patients be better educated about their health journey, their health status, for them to not just, Google things and take that as actual medical advice, or go to TikTok for medical advice. I mean, I think that, having certified virtual medical practices as the primary resource is where we can go. And, especially as, we have less brick and mortar rural care, remote locations, that's, all the places that this care can really step up. There is a platform that I recently learned about called, I don't know if it's right to call it a platform. It's called Avenir Health. They're a digital health network. They're working with CVS Health, the Cleveland Clinic, and a few other health networks with their own private blockchain, that they're starting to employ this very concept of integrating records amongst the national network of different hospitals and healthcare access points.
Yeah, really awesome conversation. You really highlighted what this technology is, potential applications, pitfalls. Last thing is, what do you say to the a physician turns on the Bloomberg or CNBC and they hear crypto, NFTs, scam, regulation? What do you say to the audience?
So, I mean, how the mainstream media portrays things is sometimes the opinion of a few. I believe that, that could be highlighting scams. It could be highlighting a negative experience with the technology, but scams and negative experiences have been happening before all this technology came to light. It's kind of similar to what they said when the internet first started being widely available in the 90s, that, this is just a fad and it's going to go away. It's like, no, it's going to keep evolving, as we evolve in our uses of it. I think it's important to keep an open mind and look at these other applications, because, especially when the mainstream media covers things like FTX and those kind of, this crypto company went bust, and it's just like, well, that really wasn't to do with the technology more than it was to do with the money and that aspect. But that doesn't have a direct correlation to the technology itself and what it can do for other fields.
Yeah, like I said, it's the Wild West, still early innovation, technology, but to follow the trends. So how can people contact you, follow you, connect with you on LinkedIn, etc.?
Yeah, so I'm on LinkedIn as Dr. Melissa Walsh. On my socials, I'm Spotty Wifey, SP. I also have a website, Dr. Malone. So I'm available at all of those locations. And I'm really, really grateful to be here today. Thank you so much.
Yeah, great conversation. And for all y'all, Melissa's, I should say, Dr. Walsh resources will be in the links and show notes. And thanks so much for providing so much information, expertise, and guidance.
Thank you so much.
I hope you really enjoyed that wonderful, inspirational, motivational piece. Again, wherever you are listening, if you liked it, be sure to like, comment, share, subscribe. We're on everywhere: Spotify, iTunes, Google, Amazon, Audible. And without much ado, be sure to thank this show's sponsors, and we'll see you next week.